Good morning, everyone. This is Dr.Anupama Tadepalli, professor from Dept. of Periodontology, SRM Dental College, Ramapuram campus in Chennai. I am here today to explain about pre-gingival graft suturing. We all know gingival recession is very prevalent nowadays, and this gingival recession is nothing but apical migration of this marginal gingiva and leading to root exposure into oral cavity, leading to sensitivity or sometimes even root caries, and it causes a lot of aesthetic concerns. And whenever patient has sensitivity, functional problems also. The gold standard treatment for gingival recession is the autografts harvested from the palate. And these grafts from palate, they are transposed to these recession sites and they will be securely sutured, and then we expect the graft to be transformed into the keratinized gingiva in the recipient site. The crucial element or aspects of this surgery lies the first part in harvesting ideal graft of thickness and dimensions, and the second part is securing to the recipient sites. Whenever we obtained graft, we need to properly adapt to the recipient site without any dead space, so that the plasmatic circulation will take up and the graft survives and it will be taken up into the recession sites. So let us see the suturing technique of this pre-gingival graft. We are showing on a typho model. So this is at the end of the suturing. Let us begin the suturing. So when we start the suturing, imagine this blue color paper is your autogenous graft, pre-gingival graft. So when you start this suturing, first you need to adapt the graft onto the recipient site and see on the mesial direction and distal direction whether you have adequately prepared zone. Similarly, you have prepared zone in the apical aspect also. And this de-epithelialized area is critical. Why? Because if you don't have enough de-epithelialized zone, the epithelium from this adjoining margin, it will start creeping into the area between the graft and the recipient site. And it will end up in separating this graft from the recipient site. And coming to the securing or suturing of the graft, you need to do graft suturing on the lateral aspect, and you need to stabilize apicocornal aspect and mesiodistal aspect. So this lateral aspect, what we do is on the four corners of the graft, we usually do the simple interrupted suture. This is nothing but a direct loop suture, where you pass on the suture from the margin of the graft into the adjoining de-epithelialized zone. So once you do this loop suturing, you will stabilize this upper portion of the graft. So here we are doing upper lateral aspect of the graft, so or cornal aspect of the graft, and we will see that we take a bite 2 millimeters away from the margin of the graft and 2 millimeters adjoining far from the graft end. Once we take the bites, make sure that you put the graft in a proper position with your periosteal elevator, stabilize the graft, and you proceed with the knotting. So in these knotting aspects, when you do the knot, so preferably leave the knot onto the graft side. So this knot will stabilize the position of the graft in the same portion. So finish off your knotting process. And remove the excess suture thread. Cut off the excess suture thread. Leave only 2 to 3 millimeters. And once you do it one process, continue the same thing on 4 lateral borders. That means the lower areas, lateral border, same way on the mesial and distal aspect of the graft. So 4 corners you finished off the suturing. Then the next portion is vertical stabilization or apicocornal stabilization. This aspect of stabilization you do with the help of a combination of periosteal and sling suture. So you have relieved the muscle attachment at the apical portion of the graft. So now you are having here periosteum. So take a bite into the periosteum like a horizontal mattress suture. So take a bite make sure that you have the engagement of periosteum, and then pass on the suture thread through the interdental areas. So pass the needle without any tissue bite interdentally. Okay. Once you pass on both sides interdentally onto the lingual aspects, place this knot onto the cingulum. So secure your knot onto the cingulum. This will help in suspension of this graft close to the recipient site in a apicocornal direction. Okay, while placing the second knot, you see that whether this apicocornal stabilization is properly placed or not. See, is there any gap between the recipient site and the graft? So once you are sure that there is no gap between the adapted graft and the recipient root surface, place your second knot and secure it tightly. This will finish your apicocornal stabilization of your graft. So cut off the excess suture material, and this process you have to do based on your width of the graft. For example, you have done grafting only for single tooth, a single vertical stabilizing suture will be sufficient. But if you have done a grafting for multiple teeth, you need to do it in multiple times. You have to do this vertical stabilizing suturing. Then comes to the special suturing that is known as Holbrook-Oceanbein suturing. This suture mainly helps in horizontal stabilization. So this will avoid the dead space between the graft and your recipient bud in a mesodistal direction. So technically, this Holbrook-Oceanbein suture, it will help you to stretch the graft and make it closely adapt to the root surfaces. So this is nothing but a horizontal mattress suture. It's a, for your easy understanding, I'm telling you, this is like a horizontal mattress suture where you take the first bite from the margin of the graft, and second bite you will be extending into the adjoining prepared bed and come to the opposite side again from the other end of the graft in a horizontal direction. You take bite and secure it to the recipient site. So in a horizontal direction, you will be having this Holbrook-Oceanbein suturing, and this will help in stretching the graft and make sure or ensures the graft is closely adapted to the recipient bed. Okay. In this area, we suggest you to place the knot onto the recipient bed, not onto the graft. Okay. Once you place this Holbrook-Oceanbein suture, your suturing part is complete, and you try to move the graft onto the recipient bed in various directions. If it is not moving, that means your graft is secure onto the recipient bed, and you can proceed for placing your periodontal dressing. Okay. So this completes our grafting. So I'm showing one patient where we had done lower gingival recession. This is a graft modification of free gingival graft. We call it a gingival unit transfer, where we have stabilized lateral aspect with simple loop sutures, and in apicocornal direction with the vertical sling sutures. And here, since it is a narrow portion of the graft, the width is very less. So we didn't do Holbrook and Oceanbein suturing. And you can see post-operatively, the graft has taken up very well, and we got like 100% root coverage. This is another patient where we have multiple sites. As I told you, when you have done the grafting for multiple teeth, this horizontal stabilization is essential. This Holbrook-Oceanbein suturing is very much essential for success of your graft. Thank you for your valuable time.